Hello and welcome to the program. I am Kabir Ibrahim. First, the highlights. The federal government pledges more budgetary allocation to the health sector, while the Director General of the NCDC, Dr. Chikwe Ihekwezu, advises targeted spending. A representative of WHO in Nigeria, Dr. Walter Mulumbo, warns that Nigerians should take vaccination seriously to avert third wave of COVID-19. And first international shipment of medical supplies to aid the COVID-19 fight arrives India from the UK. Well, barely out of the second wave of COVID-19, Nigerians are being asked to prepare for a third wave. The Presidential Steering Committee on COVID-19 gave the heads up in view of the grim situation in India and other high-burden countries. The committee is concerned that people might be getting carried away with the low figures being reported daily by the NCDC. In the last 24 hours, 37 new cases of the virus were reported across the country, with Lagos accounting for the most, with 26 infections. No death was recorded, while over 7,000 cases remain active. Nigeria's vaccination drive is still ongoing, with over 6,000 COVID-19 jabs administered in the past 24 hours, bringing the total vaccination to 1.18 million, which is still less than 1% of Nigeria's total population.
As the world focuses on vaccines to protect against COVID-19, more organizations have joined in the ongoing World Immunization Week campaign to highlight the importance of vaccination to keep families and communities safe. The Nigeria Center for Disease Control and the National Primary Healthcare Development Agency are asking Nigerians to take action and ensure that they get vaccinated against preventable diseases such as COVID-19. In an update by the National Primary Healthcare Development Agency, 58.4% of Nigeria's target population have now been vaccinated. Over 200,000 people in Lagos have received the first dose of the vaccine, while more than 60,000 in Kaduna and Kano states have been vaccinated. Meanwhile, the Presidential Steering Committee has now resolved to meet twice a month to deal with leadership and technical issues. The chairman of the committee, Bas Mustafa, who disclosed this at the briefing held yesterday, added that they will continue to escalate the management of the vaccine access and acquisition to the highest political level and hold emergency meetings if needed. The single-day COVID-19 count in Nigeria continues to be relatively low, with a record of 37 new infections in the last 24 hours. According to data published by the NCDC, the new cases were reported in 6 states, with Lagos topping the list with 26 cases and Ogun with 4 cases. Kaduna, Rivers and Kwara recorded 2 cases each, while Edo recorded 1 new infection. The latest figure raises the total number of confirmed cases in the country to 164,756. The NCDC also reported 37 more discharges in the last 24 hours, bringing the total recoveries in Nigeria to 154,963. According to the update, no new death was recorded in 24 hours, leaving the fatality toll in Nigeria at 2,062. Globally, more than 147 million cases and over 3 million deaths have been reported.
Well, the federal government is restating its commitment towards increasing funding for the nation's healthcare sector to meet up with the challenging needs in the sector, especially as it battles the effect of COVID-19. Well, this assurance was given by the DG Budget Office, Dr. Ben Akabweze, who explains that the healthcare financing in Nigeria has so far been inadequate, as budgetary allocation has barely exceeded 7% of the nation's total annual budget. On his part, the Director General of the NCDC, Dr. Chikwe Ihekwezu, is appealing for long-term plans to meet up with the infrastructural gap in the sector. In 2021, the total allocation for the Health Ministry plus statutory transfer is less than the 5% of the nation's annual budget.
The ministry advocated for resources to enable the country prioritize its responses to the global health crisis in order to minimize the nation's risks, both at the national and subnational levels.
To build our long-term resilience,
we need to fund health security. We need to fund the various ministries, departments, and agencies that have a role to play in health security. And that's why this meeting is not only about NCDC, it's about all the various interventions, some of them sitting in very other critical agencies and departments across government, to make sure that we do the budgeting right, we identify our priorities, we make the case for those investments in those areas, and make sure we start planning and advocating with purpose. It's not enough saying a government should invest in health security. It is too broad a term. So we have to narrow it down to those specifics, the specific activities, the specific equipment, the specific personnel.
But Nigerians are still vulnerable to the deadly coronavirus despite the ongoing vaccination across the country. And this note of caution is coming from the World Health Organization through its country representative, Dr. Walter Mulombo, when he led a delegation of medical experts from the global health body on a courtesy visit to Governor Nyesom Wike of Rivers State at the Government House in Port Harcourt. He warned that Nigerians must take vaccination seriously to avert a third wave, while commending the Rivers State government for showing exemplary leadership in tackling the spread of the virus.
It's been more than 1 year since Nigeria, like other countries of the world, has battled to survive the COVID-19 pandemic. Although its viciousness is being put under control through pharmaceutical and non-pharmaceutical means, there is need to engage more stakeholders to improve the response and prevent a possible third wave, as well as tackle other diseases like malaria, HIV/AIDS, and tuberculosis. It is for this reason that the country representative of the World Health Organization leads a delegation of medical experts from the global health body to meet with Governor Nyesom Wike of Rivers State at the Government House in Port Harcourt.
I would like to emphasize that we are still vulnerable until everyone is safe, until all the groups that need to get the vaccine get them. We really want to count on you, Your Excellency, to avoid the catastrophe that was predicted for Nigeria that we have avoided so far.
The visit, which coincides with the World Immunization Week, presents an opportunity for the WHO to give its assessment on healthcare policies and programs of the Rivers State government.
I also like to appreciate your standing as malaria ambassador of the state and payment of counterpart funds for the Malaria Impact Project.
For Governor Nyesom Wike, providing quality health care service for his people is not negotiable.
We will not relent to see that our people are free from it, even though it is not easy. In fact, in order to make sure we have more doctors, we gave scholarship, 100 Rivers indigenous every year to study medicine and other related courses.
Governor Wike is also promising to sign into law the state's health insurance contributory bill as requested by the WHO to further strengthen the healthcare system, which has been shaken by the COVID-19 outbreak.
As of today, 527 cases of COVID-19 have been recorded with 16 fatalities across Jigawa State. Now, only 26 patients are on admission, while 485 people have been treated and discharged since the outbreak of the pandemic. However, compliance to COVID-19 preventive measures seems to be low in the state capital, where most of the infections were recorded.
527 COVID-19 cases have been recorded since the beginning of the pandemic in Jigawa State. Dutse, the state capital, was locked down for over a month. However, activities have since returned to normal. Markets and other places of business are buzzing with activity, but preventive measures for COVID-19 are mostly ignored.
So I'm talking to you now, the COVID-19 protocols are not fully observed in the state because of negligence by the members of the community, or ignorance, or just the negligence, and this is very serious issue. Not following the COVID-19 protocols in the state is not helping matters at all.
The representative of the civil society organization of the State Task Force on COVID-19, Comrade Musbao Basirka, believes the measures should be taken seriously in the light of the effect of COVID-19 in Nigeria and other climes.
Initially, during last year, during the pandemic, when the pandemic at its peak stage, some people, even at that time, are not believe there is anything existing in Corona because they are not seeing people dying, they are not seeing people suffering much. But by looking some statistic and what is currently obtainable in some other countries, you believe Corona is still in existence.
About 35,000 individuals were targeted in the first phase of vaccination out of a population of over 5 million. It is expected that the state government will take necessary action against the low compliance to measures to prevent another outbreak in the state.
Now let's speak with Dr. Kabir Ibrahim, the Executive Secretary of Primary Healthcare Development Agency in Jigawa State. Good evening and thank you for joining us on the program. Clearly a huge challenge you have on your hands with compliance with non-pharmaceutical preventive measures. I don't know if you ever get to a point where you go, you know what, I give up. But how do you recharge? How do you keep this going?
Okay, thank you very much for coming in. We've been working really very relentlessly for the last 20 years or so since the advent of this pandemic. And, so much has been put into use. For instance, we activated all the 8 pillars for combating COVID in Jigawa State. His Excellency has directed that we observe very closely all the laid down rules and regulations related to, infection control prevention. Among other things, we have also procured thousands of masks, face masks for people to make use of. We have also provided MDAs, schools, and other public places with large numbers of, sanitizers. We have also, instituted a committee that usually goes around to make sure that people comply with these guidelines. But what's probably even more important is that we've been part of those states that have taken vaccination against COVID very, very seriously. People who are following the track of the records put for the current vaccination program for COVID, you could have seen that Jigawa was actually the first state to have the coverage that was actually allocated by the national program. So within the first week of starting the vaccination program, our own program here in Jigawa has reached the maximum number that was actually allowed for COVID vaccination. And I speak to you now, the team is still out there making preparation for second doses. Right. So we are leveraging on the availability of vaccine. We are also emphasizing on the use of the conventional protective measures, infection control and prevention, providing sustained community mobilization and other protocols that are necessary to make this process get to completion very reasonable.
Well, clearly a lot of awareness still needs to go through to the populace. But regarding testing, just to have a better sense of what Jigawa is dealing with, I weighed the figures, saying that, as you mentioned, you have vaccinated over 29,000. That's about 87.5% of the target. And you reached this in less than 2 months. But when we look at testing, on the other hand, just over 9,000 have been tested in over a year. When you weigh those figures, clearly testing could do much better. And it begs the question, just how come?
Well, actually, for testing, we are trying to ramp up what we've been doing initially. We've had a huge issue initially, mobilizing people to come for testing because of fear of lockdown, because of fear of getting to isolation centers. But having had a renewed commitment to what we are doing, people who are following the trend you see in the last 2 months or so, we've been providing, the good numbers of people who are coming for testing on a routine basis. For the last 1 month, 2 months or so. So what we are trying to do is to make sure that we mobilize a lot of people to come for testing. And that's why you are seeing we are just coming up from barely 6,000, 7,000 to nearly 9,000 now. And we're actually scaling up on that testing. Right now, we have additional molecular lab at Federal Medical Center, which when is activated, will increase our testing capacity. We are also trying to mobilize 24-hour testing service within the State Molecular Lab so that we have laboratory people working in the morning, in the afternoon, in the night. His Excellency, the Governor, has given directive that this is accelerated quickly, and we are really working hard, to make sure that we meet the minimum requirement for testing of at least 1% of the population, which is about 1% of 6 million. So for now, you see the testing is not really very bad. We're really ramping up to make sure that we meet the requirement set up by the national government.
Well, Dr. Kabir Ibrahim, the Executive Secretary of PHCDA in Jigawa State, thank you so much for your time on the program.
Thank you, sir. It's my pleasure.
We'll go on a quick break now. And when we return, we still keep our eyes on what's unfolding in India as help comes for the country from the UK. More details in a moment. Join us again. Welcome back. Well, if there's anything that has been very challenging in this fight against COVID-19, it will be trying to keep tabs on the various variants which we have. You hear about the Nigerian variant, the South African variant, the Indian variant, and it will seem the list goes on, and there are questions about what variants we will be combating in the days to come. Well, just to get a sense of how that's impacting on our fight against COVID-19 and how well we've been able to get a handle on this, Dr. Albio Adegoke joins us on the program. She's the Antimicrobial Resistance Program Coordinator at the NCDC. Great to have you on the program. I imagine that the Commission is not under as much pressure as it was this time last year. Are you wary about this seeming calm we're experiencing with COVID-19 in Nigeria?
So thank you so much for having me. We do know that COVID-19 virus is a new virus, and as all viruses, mutations occur regularly. But many of these mutations are inconsequential. We are worried about a mutation if it causes increased transmission of disease, can cause severe disease, or if it evades treatment or vaccination. This is when we are worried of a COVID-19 variant, and such variants are called variants of concern. But currently, the Indian coronavirus variant, for example, is still a variant of interest because it has not been shown. There is no evidence showing that this variant causes any of these has any of these four characteristics that I had earlier mentioned. But we do need to monitor the COVID-19, the coronavirus, the SARS-CoV-2 virus for such mutations because they do occur regularly.
So when you say they do occur regularly, in the case of Nigeria, just how regular has the Indian variant been for Nigeria?
So for Nigeria, we do have a genomic surveillance network where 3 laboratories collect some samples and sequence for occurring mutations or the current sequence some samples of the COVID-19 samples that are gotten from patients. And so far, we have logged the UK variant and even the Nigerian variant. Previously, last year, between November and December, 2 variants were flagged off in Nigeria. So that now we are still looking at the database to see if any of the Indian virus variant pops up, which Nigeria CDC would now inform the public of the occurrence of such variants and also continue to emphasize the need for everyone to keep to the non-pharmaceutical interventions, wearing of face mask, physical distancing, hand washing, testing when the person comes into the country or when the person is going out, and self-isolation for travelers. All these are important since we do know now that the virus can mutate and some of these variants might cause more harm than previously known.
So from the findings and what you have, the data you have, and the provisions you have seen, would you say that we have enough layers of protection to ward off or at least keep that Indian variant at bay?
So the Indian variant and even any other variant, and even let's say the first coronavirus that emerged, all of them can be prevented if everyone keeps to the measures that have been provided. This is very important. COVID-19 response is a whole of society response, and that is why the non-pharmaceutical interventions are important. If you do notice that you are ill, you still go to the hospital. The NCDC and other key stakeholders have trained health workers on how to treat such infections. Isolation centers are available in all states. And in addition, immunization has already commenced for anyone that is eligible. So if you're eligible to receive immunization, it is imperative that you do go to the health facility near to you, closest to you. You can register online. There's the e-registration platform. Get a date and get vaccinated. And in addition, for all travelers, for anyone coming into the country, it is still a protocol that all travelers coming into the country must have a COVID-19 testing done. When anyone is traveling out, you also have a testing done, and self-isolation is critical for all travelers.
You mentioned a critical point, testing, because for us to even know whether we have the COVID-19, the Indian variant in the country first, there needs to be, vast testing. How is the NCDC doing? We've talked about testing, setting a target time and again. We had a target which the Commission set last year for, was it a few months to hit 2 million? And we struggled and are still struggling in that light. So just how is the NCDC doing? And is there maybe light at the end of a tunnel regarding testing in Nigeria?
So we do know that for testing, persons have to report to the hospital, and health workers have to have a high index of suspicion because COVID-19 mimics many other diseases, fever, cough, diarrhea, and other symptoms, loss of taste, loss of smell. Some diseases do present in the same manner. So it is imperative that everyone is aware of these symptoms and we go to the hospital for testing. NCDC has accredited over 100 laboratories, both public and private, that do conduct tests for COVID-19, both in country and for those traveling out. In addition, I mentioned genomic surveillance. The only way we can detect variants is if samples are sequenced, and that is what we call genomic surveillance, where some of the samples for COVID-19 are sequenced through in the machine, and then the mutations and the structure of the coronavirus is elucidated. So we do have a network of, yes, please.
Pardon me, as we wind down, so they talk about the third wave of COVID-19. It's no more a matter of if, it's now a matter of when. Just how close is that third wave as we wind down?
So we do know that Nigeria is always at a risk of having an increase in cases of coronavirus. Every country is at risk. That is why it's called a pandemic. All regions of the world are affected. We would say that Nigerians need to ensure that they keep to the interventions. At the NCDC, we continue to expand our laboratory network, improve on surveillance, train more health workers to detect the infections on time, ensure that the public is aware of the risk, and continue to report transparently as soon as we detect changes in the virus.
Well, Dr. Albio Adegoke, a coordinator at the NCDC, thank you so much for your time.
Thank you.
Well, outside Nigeria, India has received its first supply of international aid to help its failing health system as ventilators and oxygen equipment landed in Delhi today. Now, many of the country's hospitals, especially in Delhi, are overwhelmed with coronavirus cases still running in high numbers.
India's coronavirus surge is hitting many homes where many have called for help, and there's been no response. People in New Delhi are crying out for help as there's no room for relatives in the city's hospitals.
And my father is in a very critical condition. I'm getting no help. Numbers are given there, but nobody is responding. Numbers are not reachable. Please help me, please.
But there's been response from the international community. Earlier today, a shipment of vital medical supplies arrived in New Delhi from the United Kingdom, including 100 ventilators and 95 oxygen concentrators. Over the past 24 hours, India has recorded over 323,144 new cases, slightly below a worldwide peak of 352,991 on Monday, with overrun hospitals turning away patients due to a shortage of beds and oxygen. The United States says it will start to share up to 60 million doses of AstraZeneca vaccine with other countries as soon as the next few weeks. But it also has India in mind.
We are continuing to look for a range of ways to help India. So we're talking about what we can redirect, what is available now. A lot of what they need at this moment is oxygen.
The World Health Organization says the situation in India is beyond heartbreaking. Director General of the Global Health Agency, Tedros Ghebreyesus, says the WHO is sending extra staff and supplies to India to help fight the pandemic.
WHO has redeployed more than 2,600 staff to support the response on the ground, providing support for surveillance, technical advice, and vaccination efforts.
Meanwhile, people continue to flout social distancing norms at a Hindu religious gathering, although crowds were noticeably smaller than previous events. Prime Minister Narendra Modi has refused to call off the festival as COVID-19 cases surge, possibly fearing a backlash from religious leaders in the Hindu-majority country. And in neighboring Nepal, health workers grapple with the rapid rise of COVID-19 cases as experts fear that thousands of people in the Himalayan state have caught the more infectious mutant strains emerging out of India.
So don't forget to protect yourself. Clearly, the virus is still out there. Continue to take responsibility. And also visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from politics to business and sports, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kabir Ibrahim.